The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone. On behalf of MMI, thank you for participating in this webinar. Presenting the webinar tonight is Dr. Andrew Heyman, Director of Medical Education for MMI's Integrative Medicine Fellowship Program. This is a preview of MMI's Fellowship Program and Graduate Certificate in Integrative Medicine. Dr. Heyman will discuss the paradigm shift in medicine, share valuable insights on how to be more successful and innovative within your practice, as well as upcoming live courses 3 and 4 live in Miami Beach on October 31st through November 2nd. If there are any questions during this presentation, please submit them via the chat option on your screen. They will be read at the end of the webinar for Dr. Heyman to answer. Dr. Heyman is an internationally recognized expert in integrative medicine. He is currently the Program Director of Integrative Medicine and Metabolic Medicine at the George Washington University. Prior to assuming this role, he spent 16 years at the University of Michigan, serving to build one of the largest and most successful academic-based integrative medicine programs in the United States. Dr. Heyman has held several leadership positions in the field of integrative medicine. He was the National Clinical Working Group co-chair of the Consortium of Academic Health Centers for Integrative Medicine for 4 years, a collaboration of 57 North American universities involved in integrative medicine. He is the online editor for the Journal of Men's Health in the section of Integrative Medicine. He also holds the position of Editor-in-Chief of the International Journal of Anti-Aging and Aesthetic Medicine. Dr. Heyman remains clinically active as well. He is the owner of a 4-physician integrative medicine practice in Northern Virginia at the Virginia Center for Health and Wellness. Now I'll pass it off to Dr. Heyman to begin the webinar.
Great, thanks Lindsay. Thank you everybody for attending this evening. I know everybody's time is precious. It's a really exciting time in medicine, and many aspects of the field are changing rapidly, and I think for some of us it's hard to keep up with those changes. At the same time, we all have the challenge of grounding ourselves in remaining good clinicians and understanding what really works, what's valuable to our patients, and sort of refining our professional skill set. So we have a daunting task, and the acquisition of new knowledge can be, a real challenge for everyone. With that being said, with the opportunity that we have here with a new training program sponsored by the Metabolic Medical Institute in partnership with George Washington University, we are able to take the best of those ideas and put them into a single curriculum. Tonight I want to talk a little bit more about what is coming down the road with regard to how medicine is going to be practiced and how this program in particular fits into that opportunity. In addition, this program is able to also serve the needs of physicians to ground themselves in what is good basic care, especially oriented towards wellness and lifestyle therapies. So I'm very excited about where things are today, and I think that this program is very well positioned to serve all of those needs for the learner. So the mission of MMI, MMI was established as an organization dedicated towards promoting health and prevention of disease by educating health professionals, researchers, and the public. And the real focus is on, in particular, absolutely wellness and lifestyle and optimizing an individual's health with regard to the kinds of thinking that we deploy and the variety of techniques and therapies that we want to teach and have our learners offer. We think this in many ways is an antidote to the current ills of the healthcare system, which is overly disease-focused, overly pharmaceutical-based, with not enough attention and resources towards supporting the individual in their communities, and the training programs that we sponsor at MMI are designed to really address those needs. We do that through a variety of formats, including formal conferences, workshops, In addition, we know that practitioners are obviously very busy in their lives, and it can be expensive to attend face-to-face sessions. So we also are making available online training, which really has been shown to be a very efficient way of learning. But it also has some drawbacks as well, which I'll talk about in the context of this new training program with GW. And then, of course, more fully and extensive opportunities such as fellowships and certification programs. The one that I'm talking about tonight was developed in collaboration with George Washington University. And this really occurred over many, many years of discussion and development, at least 3 now that I look back upon it. And it also represents a very special time in medicine where even at the institutional level, large organizations are coming to the realization that doing business as usual, however exciting certain scientific advances are in the mode of traditional medicine, we're also missing a lot of opportunities with regard to really changing the way we think about health and what we offer as interventions and strategies. And what I mean by that in particular, at least as far as GW is concerned, is that all the way up through the level of the dean of the medical school, the senior dean for health sciences, the executive for health affairs, they all are incredibly enthusiastic and supportive of our program in particular. They feel that what we're teaching is not only intricately consistent with the mission of George Washington University, and they're going through their own reformation with regard to wanting to be seen as a more wellness-oriented academic institution, but then again also it's addressing these greater public health needs that as individual practitioners we all struggle with. In that regard, the curriculum that we've developed has undergone an extensive review process by the curriculum committee at GW. All of the evidence has been reviewed in detail. It was actually quite a rigorous process from beginning to end and an enormous effort. There was a lot of thought that was put into what we're teaching, how we're teaching it, not just the didactics, but the practical aspects. And we hope that what that results in is an excellent learning experience for people and one in which that they really haven't seen before, which I think is in some ways a very distinguishing feature of this program. It's not as if we're just putting weekend workshops together and inviting speakers who are sort of unintegrated in their ideas. Just the opposite. This is really given by true faculty from GW that has spent time working together to develop this curriculum. Additionally, through the program, students will understand the importance of blending technologic advances in medicine. What that really means is that the role of technology is playing a greater part with regard to how medicine is practiced. And this goes well beyond measurement tools and devices like advanced MRI systems. This gets into more online platforms that link patients and practitioners together, and that these environments, in fact, not only support the care process, but also allow for the opportunity for data collection. We also believe that the intersection of technology and wellness is incredibly important and a whole new area that needs to be better understood and expanded. In the program itself, we'll be utilizing technology as part of that process, both with regard to training practitioners on technology so that they can deploy it successfully in their practice, but also understanding the role of technology within the context of a research process and its ability to collect data. At the same time that we want our learners to be savvy when it comes to technology, we of course also want them to be incredibly competent with regard to their ability to relate to their patients, to care for them as individuals, to develop that sort of therapeutic trust that is so incredibly important between practitioner and patient, and unfortunately is being degraded quite quickly given where medicine is today and where it's going, especially with regard to the pressures of insurance and the rapidity with which physicians now need to see patients in clinic in particular. So the question then is, how do you balance this avalanche of information that's coming down the road over the next 5 to 10 years, in addition to absorbing knowledge and skills that might be totally new and different, and at the same time grounding the practitioner in the basics of good patient care, all within an orientation towards wellness and optimal aging. And we feel that we've sort of struck that balance within this program, one that was difficult to do and obviously required a lot of thought. But I think all of these pieces are very distinguishing features compared to what's being offered today. So what is integrative medicine proper? That is the term that we're using for this training program. In the marketplace of ideas, especially when it comes to wellness and lifestyle and aging and regeneration and rejuvenation, which our space has become very, very busy in that regard. And there's clearly quite a little bit of overlap in terms of what's being taught and practiced. With that being said, at least within academic circles, if you fall into that broad category in one form or another, the term integrative has been the one that has been formally accepted at the institutional level. And one can debate the pros and cons and the merits of that, but back in 2005, when there was this collaboration of universities that was just beginning to form across the U.S. at the medical institutional level, there was this sort of global acceptance that we needed to have a definition that characterized what it is that we're about, and that we all agreed that the label integrative made the most sense. So this is the formal definition that was agreed upon. So integrative medicine has been defined by the Consortium of Academic Health Centers for Integrative Medicine as the practice of medicine that reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic approaches, healthcare professionals, and disciplines to achieve optimal health and healing. And while this is a bit long and cumbersome and even rambling to some degree, and I think in some ways that's the struggle of the identity of integrative medicine. It's not very distinct and narrow. At the same time, it attempts to embrace this notion that we are whole people in whole environments and that we live in a very complex world. And the question then is, if integrative medicine is attempting to deal with that sort of holistic complexity, what are the features that we think are pretty important? And so this definition begins to try and characterize those pieces. And at the end of the day, I think maybe the most important is that final sentence regarding optimal health and healing. And that is to say, we don't have a strong orientation towards disease identification and management. And while we don't eschew that, at the same time, we also feel that many illnesses that people contend with are much better managed if we address them early in their process, that in fact if we're more preventive and even predictive in our analysis, and that as we push people towards greater and greater wellness, by definition, the risk of their development of disease decreases over time. Beyond integrative medicine, I think while there are sort of traditional characteristics around the field of integrative medicine that many people automatically begin thinking about with regard to traditional healing systems such as Chinese medicine or Ayurveda or herbs or homeopathy, there has to be an attention to drawing upon new therapies and new approaches and embracing science as it evolves, because many of these older ways, however important, however much we need to respect them, also need to grow in some sense as we integrate new ideas in the way that we think about patients and sort of the process of illness to health. And so in the curriculum, we have an attention to what is new and what is different. And while we are grounded in the therapeutic relationship and some of the softer interventions, we also absolutely embrace what's new and exciting and interesting about what's going on in medicine today. And so one of the key and core concepts that we feel is incredibly exciting is called systems biology. And that is to say, we recognize on a molecular level that the body is this integrated unit. That's a very important concept, and one that might, from a certain perspective, seem obvious, but when you look at how medicine operates and is organized, we tend to chop the body up into silos. The cardiologists get the heart, the gastroenterologists get the GI tract, the neurologists get the nervous system, but it's very hard to create sort of cross-communication among specialists, and yet we know that there's a such an intricate and full integration among body systems, and that often when you look at disease processes, not just one system is changing, but multiple systems are changing simultaneously. And the question then is, do we really have the right concept of an illness process, or do we need to change and broaden and even break down those silos and reconnect the dots so that we have a better understanding of the complexity of what's going on with our patients, especially earlier on before they manifest greater physical disease. So the curriculum itself is really focused on integrating that understanding of complex physiological systems, and that's how the weekends are organized, so that you begin to see these interconnections and how different topics tend to blend together with regard to common patient presentation. Going a layer down from systems biology and physiology is the omics revolution. Genomics, proteomics, transcriptomics, these are the molecular targets that allow us to look ever more deeply into an individual's metabolism. It's a very exciting area. It's incredibly challenging. And just like we've decoded the genome, there are research centers that are decoding the proteome and the transcriptome, which are the proteins and other biological markers that are expressed from the genome. And this gets into the very core aspects of you know, the complexity of the terrain, of the landscape of a patient's health pattern. And so it really gets into pattern recognition, and that is to say, when you look at the availability of being able to measure some of these new markers that most of us have never heard of before, that we're going to have the ability to assay 1,000 or 2,000 of these analytes, maybe even yearly in patients. And what's interesting about that is as we look deeper and deeper into the metabolome, it turns out that, for example, if you line up 10 diabetic patients that all have essentially the same diagnosis, under the current evidence-based guidelines, essentially they would all be treated the same. And so right now, the emphasis in healthcare is to enforce and reinforce every asthmatic is treated the same, every diabetic is treated the same, every heart failure patient is treated the same, and that physicians are expected to follow these guidelines. What metabolomics and transcriptomics and proteomics and systems biology is teaching us is that if you look at those same 10 diabetics, they all might have different metabolomic patterns. And in fact, there might be a greater overlap between one of those 10 with a certain kind of cancer or a certain kind of autoimmune disease, that when you begin to break down the silos and look at the interconnectivity, we might need to fully reformulate how we think about illness. And so this ability to identify these patterns is here today to some degree, but certainly will be much more robust probably in the next decade or so. And it's a very exciting time in that regard. And what's interesting is that it will allow us to further individualize care. When you look at the older healing traditions, this is exactly the same notion. Traditional Chinese medicine, Ayurveda, homeopathy, each oriented themselves to the same task, and that is to say, through observation and questioning, the greater amount of details that you could collect on a patient, the better you could refine the diagnosis, with an emphasis on the individuality of the process, that everybody is different. And interestingly, now maybe for the first time, we are discovering some of the biological correlates that these older practitioners over thousands of years have observed. And so we, in fact, might be coming full circle in this regard and probably moving away to some degree from treatment guidelines and evidence-based medicine in a sense, at least as it's defined today, which I think is a good thing, because when you create an average with regard to a treatment idea, so every hypertensive patient should follow JNC8 guidelines, you probably miss a lot of people in terms of getting them better. And the question then is, how do you individualize your approach for each patient and yet still improve their health overall? One of the ways you do that is through the role of technology. Technology allows us to collect those analytes. It allows us to understand what are those deeper aspects of their metabolism. And this is part of where technology is beginning to play an ever greater role in the process of care. as practitioners, we need to be comfortable with that idea. And of course, what this leads to is the great challenge of information overload. So technology can help us collect a lot of information, but it can also help us synthesize and understand what that information means. Not just in terms of biological measurements, but of course through self-report and biometric reports, everything from online systems to wearable devices. We as physicians will need to be information managers in a sense. And that's a great task and challenge, but one that isn't going away. And the question then is, how do we better understand the role of information and technology in the process of healthcare? What this then leads to in a very natural sense is, as we're collecting more and more data on an individual patient, what does that data mean? And when you look at traditional research models and how we understand data, it's all been, up until this point, mostly hypothesis-driven, meaning that we like to conduct randomized controlled trials based on a hypothesis or null hypothesis, and then we come to a biostatistical conclusion. But the world is changing. If we're able to collect 1,000 data points on an individual patient in time and track those changes over time, you then have a complexity of that data set that is what's called non-hypothesis driven. So we don't go into dealing with that data with a preconceived notion. What we're looking for are patterns within the data. But that's a very difficult task because there's typically a lot of noise in the data. So what we want to do is have mathematical models and tools available to better understand that complexity. I think on a certain level, this is the task that's been set up, especially within the functional medicine world. But at the same time, I don't think there's been enough attention and sort of academic respect for the amount of data that is typically collected and what it really means. Because it's only through complex models that we can better understand the meaningfulness of the data that we're looking at as you expand a data set. And so all of these pieces have to be combined together. Systems biology, metabolomics, the role of technology, our ability to understand data, and that then means also physician as a researcher or practitioner as a researcher. I think especially for us to move this whole field forward, especially due to the criticisms that you often hear about integrative medicine or anti-aging medicine or age management or functional, and some of that is true, that there probably isn't enough data to support what we do as practitioners. But through good education, technological tools and platforms, and the ability to collect data across clinics, we then have an opportunity to perform outcomes research, to look at practice patterns of physicians and how and why patients are getting better. And so that's the final conclusion, I think, with this curriculum, and that is to say all of those elements are being put in, and especially with an emphasis to encouraging practitioners and learners that when they go back to their practice, we give you the tools to actually collect data. We can pool that data across clinics and begin to say something meaningful about what we're doing and publish collectively. So this is a very exciting piece to what we're integrating into this training program. And obviously it's not all in one weekend. There's no way to do that. But what we're looking to do then is, yes, focus on the foundations of integrative medicine, but expand that idea to create the more complete professional in that regard. So the MMI IM program, again, expands on integrative medicine concepts by including these newer ideas that I've just mentioned. And again, doctors will be information managers in a sense to make better decisions, intervene earlier, be more predictive about the disease trajectory of their patient, and help them move towards a greater sense of wholeness and wellness and build their vitality. So in my mind, the 21st century medicine is a blend of all of these ideas in a sense. So early detection of physiologic imbalances, an individualized assessment, systems-based approach, but very relationship-centered and focused on the needs of the individual, and a true integration of disease management and health building strategies, and then finally a reliance on technology and information-based care. This is, I think, the new identity of the excellent practitioner and professional. It's a great challenge, and one that I think is hard to encapsulate within any single curriculum, but I think we've done a very good job of moving in this direction and beginning to meet the needs and challenges of a new way of doing business in medicine. To that end, I've just put in a few slides to represent what are some of the basic technology tools that not only operate in service of caring for patients, but that in turn also allow us to collect data on patients. Because we're wellness oriented, we're looking for technology packages that help serve those specific kinds of needs. This system in particular is oriented towards delivering excellent dietary advice and exercise prescription. And so you can see there are many, many, many different diets that have been put into this particular system, and that when you assign a diet to a patient and they go home and log on to their patient portal, they then have a fully realized dietary program that's very detailed with regard to how to eat better and more properly. It's sort of like having a dietitian who's already been programmed right into your clinic, but that you have total control over what's being assigned to the patient. This, to me, is a real breakthrough. While there have been some technology companies that have tried to address this issue, there are very few that are as robust as this particular program. We're going to see more and more of this in time, and certainly more competitors. But this is something that I want my learners to be exposed to, because it's an opportunity not just to have extra resources that are critical and central to caring for patients, but then again, as part of these technology platforms, you can track what patients are doing and eating, how well they're following their guidelines, whether or not they're making improvements, and all of that data potentially becomes meaningful with regard to their outcomes, and therefore an opportunity to potentially even publish. This is just a screenshot of the exercise component. It was very nicely done. You can assign various kinds of exercise prescriptions to the patient, and it's quite detailed in terms of the different movements and components. So what will I learn? Graduates of the program will be able to establish a practice in integrative metabolic medicine, apply the core competencies for clinical practice through development of integrative medicine practice plans, apply the principles of whole person care to clinical practice, integrate fundamentals of nutrition and metabolism into an integrated care plan, integrate omics information into personalized treatment plans, learn to utilize technology and wearable devices in service of patient care, and then begin to collect outcomes data through your practice. How is the weekend courses organized? So when you look at the MMI structure, there's two opportunities. One is to attend 3-day modules or courses, as we call them, in addition to the availability for online as well. And I'd like to say up front, as much as we want to be thorough, evidence-based, and academic with regard to what we teach, at the same time, we're also very sensitive to the common criticism that when you attend many conferences in whatever discipline that's out there, and you invest a lot of time and money in that process, the real question is, what do I do on Monday? And how is this going to change my practice in essential ways? And so each weekend, we're very focused on the experiential component of the learner as much as we are the didactic. So I care quite deeply about ensuring that each practitioner who attends walks away with real tools and not just knowledge. I'm an active practitioner myself. I see patients every day, each week. And I know how important it is that when you have new knowledge, you want to learn how to enact that knowledge. And so in so many ways, as we're trying to strike balances between all sorts of opportunities, this is another balance, and that is between knowledge and skills. And we're trying to find the right one in that regard. And you'll see that with many of these weekend courses, there's probably a greater emphasis on than normal on the practical aspects of application. So course 1 and course 2 were recently held in the beginning of June. The first was Keys to Lifestyle Medicine. These are the foundations of wellness. It's how do I relate to a patient? How do I engage them in a therapeutic process? How do I build trust? Which is often overlooked as a skill set, because it's not just the amount of time that you spend with a patient, because we typically do spend more time with patients, but what is the quality of that relationship? But But the other pieces to that then is if we're focused on relationship and connection and positive behavior change and sustaining that change over time, then what are the behaviors that we're very, very much focused on? Well, two essential ones, of course, are what people eat and how much they move. And so we've paired a focus on therapeutic relationships with food and exercise. We're very excited about this particular weekend because, especially when it comes to nutrition, we're very focused on diet, not just testing for food allergies and sensitivities and elimination diets, but understanding the role of diet and how to choose among diets when you're dealing with patients. And then finally, exercise prescription. And as much as I think we pay lip service to advising patients to eat better and also advising them to move more, we're probably, if we're honest with ourselves, not very good at either. It's why we've specifically been looking for, in particular, online tools and platforms that help us in that regard, and something where patients can engage in that process when they leave the clinic, because it does take time. So unless you have a dietitian on staff, it's not that easy to deploy diet and exercise prescription in a practice. But there are two essential components. The second course is on stress management and management. We feel that this is essential as well. I also, in particular, have a personal opinion about how stress is treated, and we've really expanded that concept. Of course, understand that there's a great overlap with pain, and certainly at least psychological discomfort. This weekend in particular was very interesting because we went from very old to very new in terms of what we taught. Yes, we reviewed how to handle acupuncture needles and deal with trigger points and inject homeopathic remedies into subcutaneous tissue. We also covered the psychological aspects of pain and stress and how to better deal with that and counsel patients in your practice. We also then moved into the more kind of social and spiritual dynamics of stress and pain, and therefore we taught about how to run group visits in the practice so that you build collegiality and connection in between and among patients. But then we finished with something very exciting and new, which was PRP, or platelet-rich plasma. This is a therapy that falls into the regenerative medicine category, and that is to say the ability to draw blood, spin it, separate out platelets and plasma, manipulate that blood product, and then re-inject it back into the patient for regeneration and wound healing and reversal of arthritis and for aesthetic purposes. We had a whole afternoon on that, and learners felt very competent after they left to begin to engage and use PRP in their practice. So this was a wonderful one-two punch, in a sense, of these two courses. Courses 3 and 4, which are upcoming in the beginning of October, the end of October, beginning of November, are a little different in their orientation. They're much more, quote-unquote, sort of functional in a sense. We get into those more traditional concepts in that regard, but both in the way that we've organized content as well as the speakers that we've brought in, I think are very different and very exciting. And course 4 in particular is absolutely a representation of what's coming down the pike with regard to how to better understand complex patients in particular. So course 3 really focuses on cardiometabolic diseases. We have a whole first day with Dr. Houston and Sinatra and Bacris. Dr. Bacris is the chief of cardiology at University of Chicago, and we're looking at new and exciting concepts in cardiovascular health assessment and intervention throughout the entire day. It's something that I think is very exciting. We then, for the next day, focus on insulin resistance, lifestyle issues, and obesity, which of course have a high degree of overlap with cardiovascular disease. We then focus for the rest of the time on either managing hormones for men and women, which of course fit into the context of cardiometabolic illness, and then finally the role of toxins and exposures and how to deal with that thoroughly and effectively. And when you look at the lineup of speakers, everybody who's speaking in this weekend is an exciting and incredible expert in their content area. They have years and years and years of clinical experience, but also they're strong academics. and it's a wonderful mix in that regard. So the concept that I had in mind, for example, is that 55-year-old male patient who's under stress, gaining weight, developing insulin resistance, endothelial dysfunction, and vascular damage that's heading down the road towards diabetes and heart disease, but also is declining in their hormonal status, probably low testosterone, high estrogen. But then, of course, you also have the final overlay of exposure to exogenous chemicals and hormones, such as organic pollutants and heavy metals. And so that nexus of how do I encourage my patient to break his insulin resistance, lose weight, repair his cardiovascular system, detoxify chemicals, and manage his hormones, I think is a really important central concept that needs further attention and refinement. And this weekend in particular is designed for that. Course 4 is something different altogether. This is the weekend that will help orient the learner to the complex patient that no one can figure out. And our concept is that when you have these patients that kind of fall into the wastebasket categories of fibromyalgia and chronic fatigue and depression and weight gain and neurologic illnesses and psychiatric illnesses, this sort of very messy mix of symptoms and illness processes, sometimes that seem to escape conventional diagnosis altogether, but everybody agrees that this patient is really, really ill. And we just don't have great diagnostic tools and therapeutic strategies to help manage these patients. And while I think there's been an adequate job that's been done through the integrative and functional and anti-aging world, there's a whole different and new way to look at these patients, which I think is a lot more revealing. And at core, from a systems biology perspective, many of these patients fall into the category of dysfunction within the interrelationships between the digestive tract, the immune system, and the nervous system, with the brain being involved in particular. I think while traditionally we feel we know how to deal with the digestive tract from an assessment and therapeutic perspective, especially from an integrative world view, we can always do a better job, and there are actually new markers that are now available that provide even greater insight into what's going on, not just within the gut, but between the gut and the immune system in particular. So the first day is really an incredible group of speakers, beginning with Linda Lee from Johns Hopkins, who's an integrative gastroenterologist. We then have Alessio Fasano coming in from Harvard University, who's really defined the field of gluten sensitivity and gut immunology. Eva Sappi from University of New Haven, talking about the role of microbes and biofilm in terms of not only creating gut dysfunction, but more general immune dysfunction. And Cheryl Burdett out of Dunwoody Labs, who's a naturopath who's done a lot of work on new and innovative gut measurement tools. So the whole day is really a wonderful survey of how better to look at the gut, what are the new markers, and what are new ideas that you might not have encountered in the past. The next day is on immunology proper, and we're going to delve into, yes, the basics of the immune system, but in particular, innate immunity in particular, because this is the system that tends to turn on with exposures and biotoxic insults that can't turn off, especially given certain genetic patterns. So we're inviting Tom Williams, who's by training a molecular immunologist, who's going to cover some of the basics of the immune system. But then we have a wonderful series of lectures by Richie Shoemaker and Jimmy Ryan, who are going to cover the role of biotoxic insults in terms of triggering the innate immune system, and ultimately then how that impacts in particular the brain. Because it turns out that the organ that tends to be the end site of damage is the central nervous system. And so we'll be covering what are the new measurement tools, especially techniques like NeuroQuant based on MRI studies that can better characterize brain-related insults that are occurring because of these immunologic processes. So we're looking at that nexus between gut dysfunction, immune activation, and literally brain damage, and at least functional changes in the brain. The third day gets into what are the expressions of that damage. So we have Kelly Brogan, who's a wonderful integrative psychiatrist, very well known in the field, who will be integrating her concepts of how to better understand psychiatric illness within the context of these biologic processes. And then also we'll be ending with a wonderful physician from the military, Josh Duckworth, who oversees all of traumatic brain injury for the West Coast and has done quite a bit of work in looking at imaging studies and assessments to better understand the neurologic components of both acute and chronic illness, especially as it relates to the brain. And so we're pulling all this together into one neat little package where when a patient walks in and they say, I'm gaining weight, I'm anxious, I can't sleep well at night, I have numbness and tingling, I have bloating and maldigestion, my joints are achy and inflamed, we're going to show you how to dissect those patients and demonstrate that, in fact, oftentimes there's an insult that's still going on in that patient's life that needs to be addressed. And that means dealing with the gut, calming the immune system, and repairing the brain. This, to me, is an incredibly progressive and exciting weekend. And for those of you that already feel seasoned, in a sense, with integrative medicine, I guarantee this is all new stuff. And if you're looking for something exciting, this is absolutely the course to attend. Course 5 is clinical omics. So it's genomics, proteomics, and metabolomics. What's exciting about this one is that we are bringing in some Nobel Prize winners, NASA scientists, and very sort of advanced thinking with regard to what's occurring in the next 10 to 20 years in medicine. But we need to give a real deep dive into what do we do today in this regard in terms of testing for genetics and metabolomics, and then what's occurring in the next 10 years or so. Course 6 is on the practicalities of sort of the legal, ethical, and business management opportunities with integrative medicine. How do I establish a practice? How do I promote myself? What are the risks and benefits of this style of practice from that perspective? So we'll have a whole weekend in that regard, which I think is really important. There's more and more attention being placed on that, but we feel that that's important too. And then finally, Course 7, which is the practical experience. It's probably going to be an extended opportunity for learners, 4 or 5 days, all case-based, all small groups, bringing in live patients, and ensuring that as the learner has progressed through the weekends, that they're able to synthesize that information and demonstrate that they can actually interview a patient, develop a treatment plan that makes sense, and deliver that treatment plan for the patient so that they can understand it. So all of this will be monitored by faculty, and we feel that it's sort of the capstone for the entire course. MMI has, as I mentioned before, gone into partnership with George Washington University. So MMI is the engine for these training programs and helps to identify speakers, but GW reviews the curriculum and assigns faculty status to each of the speakers. So in fact, this is a true GW faculty in that regard. This partnership is unique. It's exciting. It's something that I've never really seen before in the field, certainly at this level, where you have this sort of private-public partnership, all focused on developing excellent educational programming for medical professionals. So after a number of years of development, this curriculum represents a lot of work that's been done on both sides and a huge amount of time and investment to create something that we think is outstanding. What it then leads to, if the learner decides to go through all of the weekend courses and then also engage in some online training as well through GW in particular, this course, if you want to call it that, then leads to a graduate certificate in integrative medicine conferred through the Department of Health Sciences at George Washington University. So there's actually a formal degree at the end of the training program. A graduate certificate is considered about half of a master's, and we felt that that was about the right amount of time because it's about 300 contact hours to confer the degree. The curriculum also reflects the new Board of Integrative Medicine that was established by the American Board of Physician Specialties. For those of you who aren't aware, about 4 or 5 months ago, for the first time ever, we now have a fully sanctioned Board of Integrative Medicine. There's only 2 governing bodies that allow for the establishment of a board. One is the ABPS. The other is a larger one called American Board of Medical Specialties. It was the ABPS who's now created the Board of Integrative Medicine. When you look at the route for qualification for the board, there are two routes. There's a grandfathered route, which is going to go away in the next year or so. It means that if you've been practicing integrative medicine for a certain amount of time and prove that you've gone through some formal training, that then you could potentially sit and qualify for taking the board. The other route is through formal training programs. There's a list of 21. On that list is GW, and we're looking to umbrella this new program as part of what's already established at GW so that you can also qualify to take the board. So what is the graduate certificate comprised of? It's an 18-credit-hour program, a mixture of the face-to-face weekends plus the online module. The eligibility requirement, you just need a degree in a health-related field with a GPA of 3.0 or higher. We do take all comers. You don't need to be a physician to take this program. And as I said, there's 7 face-to-face courses as well as some online requirements, and the total contact time is 300 hours. So in the future then, what we're trying to create is a fully competent integrative medicine medical professional with a broad skill set, advanced practice skills on wellness, systems biology, and natural therapy, technologically savvy, outcomes research capabilities, and business acumen. The exciting opportunities are, I think, the ability to collect data through our practices and then form a network of trained professionals that we're working together in sort of a collaborative effort to publish the data. And in speaking with a number of the decision makers at GW, at least for those that are interested and maybe qualify, we'd like to establish a secondary set of criteria that once a learner has gone through the program and they've received their certification, that in fact they might be invited to actually become GW faculty with the expectation that they would not only be utilizing technology and all of the clinical tools that we provide, but agree then to also collect data. So in fact, we're looking to build a GW faculty group practice based on this training program and give you all of the information and tools and technology and skills that you would need to be successful within an environment like that. And then finally, this new Board of Integrative Medicine, which I think really changes the landscape of what's important about our field. It creates sort of a protective layer in the sense that now we've been fully legitimized. There's clearly a set of criteria that we are expected to meet in terms of the standard of care. And so our training really orients towards the Board of Integrative Medicine as well. So that's all I have to say tonight. Thank you for your time and attention. I know that everybody is busy, but this really is an exciting time. I think the program is an exciting opportunity, and I'm delighted to be a part of it. This has been an enormous effort by a whole group of people, and I think that the quality of the programming really reflects that. So if there are any questions, I'd be happy to field them at this time.
Thank you so much, Dr. Heyman. We do have a few questions. However, in essence of the time, we will just address one question tonight. And the question is, what is the difference between the integrative curriculum through MMI and another functional or regenerative medicine curriculums elsewhere?
I think that's a great question. Again, I don't want to sound like, I'm repeating myself, but I'm going to be repeating myself, and that is to say, there are clearly traditional integrative medicine concepts that we'll be covering in the program. You will learn the foundations that include nutrition and exercise and the role of dietary supplements and some of the manual therapies and acupuncture and mind-body strategies that are within the curriculum itself. So I think you're going to walk away feeling very competent in that regard. But at the same time, we're sort of departing from the norm by learning to embrace new ideas, new measurement tools, the ability to utilize technology, the emphasis on physician as researcher in terms of collecting data that we feel will push the whole field forward. So we're trying to activate the practitioner as kind of full professional. And I think that that's really unique in the landscape of what's available for educational opportunities. We feel very strongly in this regard. We want our practitioners to be considered the most competent, the most savvy, the most progressive, the best educated, and yet still remain grounded in the fundamentals of integrative medicine, which is the focus on the individual and sort of whole person care. As I've said a couple times, this is a big challenge, but we do feel that we've sort of struck that balance in a very nice way. And we feel that as a learner goes through the process, they're going to be very, very pleased with the organization of the curriculum and content and find that it sort of meets their needs in very practical and real ways.
Thank you. MMI would like to thank you for your time, especially you, Dr. Heyman. Thank you for all the listeners tonight. We would like to present you with a very special offer that will be available for 48 hours. If you are interested in the live courses in Miami, please call and mention that you were a listener tonight. We hope you enjoyed the webinar. If you have any questions about the program, questions for Dr. Heyman, or if you're interested in registering for the Miami event, please call 888-846-1107 or visit mmimedicine.com. Thank you again for your time and have a great evening.